is Ed Elliott.
My name is James Kelly Wolf.
I'm Casey Malone, and I'm a community support worker here at Langhouse.
My name's Jocelyn Nelson.
My name's Amy Jones.
So I'm David Gardner. I'm a professor with the Department of Psychiatry in the College of Pharmacy. I'm a pharmacist by training.
Side effects are on my mind, how they put me in quite a bind. Weight gain, brain fog, and sedation galore. No wonder people think I'm a bore. Sometimes I think I've had my fill, that I'd rather be back to being ill. Maybe I'll try to see the tunnel of light, that newer, better medication isn't out of sight, that everything one day will be alright.
So what side effects have you experienced?
I don't know what it's called, but like lazy thoughts.
I just sweat like almost uncontrollably. Like, so I'll be sweating and then the anxiety makes me sweat, and so then I'm just big pool of sweat. So that's one thing.
Oh, the biggest one from like other medications I've been on was weight gain.
Loss of appetite, loss of weight.
It also makes me crave carbohydrates, so kind of makes me overeat a little bit.
I'm just doing a lot of things that rose out of my own character, aggression.
Irritability, changes in mood.
I honestly find that the olanzapine, it makes it really hard to get up in the morning kind of thing. It makes me really tired. It sedates me.
Sometimes really bad sedation.
Like, I got off the medication for a reason. While I was on it, I was falling asleep on buses or drooling on people's laps on the buses.
I forget which one. I think it might have been with Effexor. I would yawn all the time.
The Prozac, there honestly isn't that many side effects. It did at first give me really vivid dreams and nightmares, stuff like that, but they kind of just went away on its own.
So I got off of those, not to mention some of them really kill your libido, and that's like a no-go.
Some other ones were like sexual side effects.
I get really confused about what kind of, what I'm feeling. I just feel I feel disconnected from a lot of that. Like, I was on the bus ride here today and I was just going, oh, what do I feel right now? And I didn't really know. And so it's kind of stressful when you're like, I don't know if I'm up or down, or if I'm in a good mood or a bad mood. I just feel like almost nothing sometimes. So that's kind of stressful.
I would have to say that the medications that we have for mental illness, anxiety, depression, schizophrenia, psychosis, bipolar disorder, ADHD, and so on, they're good. They're not great. They're messy. It's a challenge to help somebody find that combination of medications that works well for them. And sometimes we look like we don't know what we're doing, because somebody can try a medication and get side effects and have to switch, and then try another medication, no side effects but no benefits, and have to switch. And it just kind of feels like we're just giving you a different medication with no planning, no forethought as to what might work. And it's really about our communications to say, this is one of several options. This option works probably as well as the others overall. But for an individual, we don't know if it's going to be the best one.
How did some of those medications make you feel? Was it frustrating? Was it like confusing, scary?
Well, it kind of slowed me down a little bit cognitively, so it was a bit frustrating. Also, like, being clumsy was frustrating too.
Man, I'm hungry. Why can't I eat?
The side effects made me feel pretty down on myself. I was happy that I had lost a lot of weight, but it was not through me trying to, and I didn't like that I wasn't eating. I didn't like that I didn't have an appetite. It made me irritable. It made me sad. And at times hungry. I actually did have an appetite, but usually when the meds were off.
I think a big one right now I'm feeling is just disconnected.
What have you done to combat those side effects?
I've had to drink lots of water. Basically just sleep in pretty late to take away this tiredness. I've did a lot of healthy eating, and I find that helps, and exercising, which kind of gets my energy levels up, kind of thing. And even meditating too helps with the energy levels.
Well, for the weight gain, I tried exercising and eating healthy, but that didn't seem to work. So I tried various medications and eventually found one that works and that I'm able to lose weight on. So that's been going good. And the sexual side effects, they also went away. And for the sedation, well, going to the gym and eating healthy, of course, that seems to help somewhat. And, well, drinking coffee, that seems to help sometimes too. But I don't know, it's still a bit of a struggle.
I ended up changing psychiatrist and going with a psychiatrist that specialized in ADHD. He was also a pharmacist first, so he knew a lot about medication. And when I saw him, I went with my whole medical history and all of the medications I had been on before. And so I was able to talk to him about how each medication affected me and the side effects. And we went from there.
So I find for the most part I just kind of zone out from them because I like I said, I do feel disconnected a lot of the time, so I just don't pay too much attention to them.
So medicinal things to try to get me hungry to eat, because Ritalin takes away feeling hungry or wanting to sleep or doing anything human. So I use other medications to maybe get that back a little bit. So what have I tried besides that? Like long bike rides, running to the woods. It's not really not taking them. I think that's the best way to not get the side effects.
There are people who take medications, antipsychotics, antidepressants, medication for anxiety, and they say, I feel great on it, I don't really get side effects, and it's worked out really well. I think they are the minority of individuals. The majority of people who are taking those kind of medications do live with the side effects. I think I learned early on, though, that people adapt to those side effects if they can. So if they're bothersome but reasonably tolerable, you'll tell me how awful they are after a month of experiencing them. But a year later, I'll ask you again about it, and you go, oh yeah, I guess I kind of do still get that side effect, but I don't really think about it anymore.
Have you considered going off, or have you gone off medications due to side effects?
Yeah, no, exactly. So there was, I was born an asshole. Took me 7 years to change that around to be a good person. I get on meds, I go back to being the asshole. It happens. I'd rather not take the meds.
When I was in the hospital, I actually went off lithium because I was I got ECT and they said I couldn't be on lithium while I did it. So I got off it, and then they asked me afterwards if I wanted to go back on it, and I said no. So since then, I've tried some other medications. I've tried lamotrigine and Wellbutrin, and they just weren't working that great for me. So I finally went on Prozac, and it works pretty good for my depression kind of thing.
I've had to go off different medication, and sometimes I would do it with the support of my psychiatrist, and sometimes I would just kind of forget to take meds and slowly wean myself off. There was one time where I actually had to take time off of work to wean myself off of the medication, which was difficult.
Yeah, I did go off them at one point for about 6 months because of the sexual side effects and the weight gain, and it was kind of not worth it in the end because I got sick and was readmitted to the hospital, and I was in good shape. I lost the weight, but I was back in the hospital. In your experience, have many patients gone off their medication due to side effects?
Absolutely. So we talk about acceptance of the treatment. If you think about it, you go see a prescriber, a doctor, a nurse practitioner, or somebody, who says, I think to help you, you take these pills. Right there is a recommendation. It's a suggestion. And you get a piece of paper and you go to a pharmacy. Do you take that piece of paper to the pharmacy? Some people crumple it up and put it in the garbage. Some people take it to the pharmacy, get it filled, walk home, look at the pills and have a second thought or a third thought and put it away for a day, a week, or forever and never take it. And then other people, they start taking it, and what's the first thing that you get from most medications for mental illness? The first thing you get is side effects. It very often takes days, if not weeks, for the medication's benefits to come in.
So do you feel that there needs to be more research to find medications with no or less side effects?
Hell yes. No. There definitely does. I'm not going to get into my whole real thoughts on why they medicate the shit out of us and stuff like that. But yeah, they should be. If they're getting paid that much, if it costs that fucking much, if there's that many people in the field doing it, maybe they should actually know what they're fucking talking about every now and then. Or friggin' talking about every now and then. And how come in every friggin' medication commercial there's a ask your doctor? It's like, they should know that.
I think yes, because I don't think that the scientific community knows as much about the drugs as probably should. I feel like, and it really should be a priority, because if people are putting these pills in their bodies and like hoping that it'll make them feel better and then it doesn't, like that can, as much as like those people are just a number, it can get quite serious if someone's on if someone's on the wrong medication or on a medication that isn't helping, it can be like, it can go to a crisis and it can become something serious.
I definitely think that there should be, because some people have very severe side effects, and it's like, even if you're treating the underlying disorder, like the side effects could be as bad as a disorder.
Yeah, I definitely think that they should have more information like about drugs, especially lithium, because like when I was put on lithium, they didn't really tell me much about it, and like if I had known, maybe I would have decided to go on a different medication. I mean, it did work for the 9 years I was on it for most of the time, but it's good to know that there's other stuff out there that has less side effects, kind of thing.
Do you think there needs to be more research into developing newer medications with improved side effect profiles?
The answer is yes, and right now we're in a lull. So over the last several years, it's been really well recognized that there's not as much research going into psychiatric medications as there used to be. If we go far back, so about 60, 70 years, the medications that were identified for psychosis, for depression and anxiety, for bipolar disorder, they were all identified as breakthrough medications, and they were discovered by chance. It wasn't that somebody said, that medication works this way, and this illness works this way, and they're a match made in heaven. That's what we're trying to do these days, is find medications through our understanding of neuroscience, how the brain works and how these illnesses work in the brain, and how the medications actually work. And that's turning out to be a lot more difficult. And the reason is our brains are super complex, really complex. And our understanding is not sophisticated enough yet to be able to say, let's design a medication to fix a very complex brain disorder.
So would you be willing to try a new medication with no or less side effects if they're developed?
I mean, if they can find one without sedation, I'd probably try it, yeah.
I would. If there was something that could replace the olanzapine that would help me sleep, I would be willing to try it, just because I kind of want to get away from the weight gain thing. I kind of want to lose that weight that I gained, kind of thing.
I've realized that for me, like, combination therapy, as they call it, like with the counseling and meds, it has been helpful in the past, and so I would like to find, but right now I just don't feel like it's effective, and I feel like it could be a lot more effective if I actually had something that had a solution. So and I think I find, especially with my anxiety, like I feel like it's not a good way to live your life where everything is life or death. Like literally every aspect of every interaction, everything I do is life or death.
Depends, really. If it was from a doctor who's not a quack and also had other things to go along with it, like if I ever went into a doctor office and they were like, "Do you want to run, do some yoga and these meds?" They'd be like, "Fuck yes, I like you." But you never hear that. It's always, "Take these meds and see me in a week." Like, so I don't know. So no, like hell no. Until they actually do some research or make it not an addictive substance, because there's really no difference between what they give us over the counter and tell us stop being crazy from what an addict fucking snorts up their nose. So there's really no difference, and until that changes, then no.
I think we do have to recognize that psychiatric medications are double-edged. The benefits we know, and that's why we prescribe them, but the side effects. So we don't know on any individual basis when we give a medication if you're going to experience the benefits with very little side effects, or if you're going to experience tremendous side effects with next to no benefits. And I think this is one of the things that we need to communicate with people who are taking those medications up front and be clear about it. I can't look at you and know which medication is going to be the best one for you. Are you willing to work with me so that we find the best medication or combination of medications so that we're in this together? And I think that would be a helpful way to go forward.